Hey everyone, Dr. Beth Zogg with Zogg Family Chiropractic. And today I want to talk to you about neck adjustments. Now, I know there is a lot of crazy stuff out there online, crazy videos of people getting their necks yanked and big pops and all that kind of stuff. So I just want to talk to you about how we do neck adjustments in our office. Now, BJ Palmer, whose father was D.D. Palmer, who actually created the science of chiropractic. His son, B.J. Palmer, had the goal of being able to provide the least amount of force into a spine for the body's intelligence to take that force and correct the subluxation. And that's our philosophy at Zogg Family Chiropractic. How can we provide just the most minimal amount of force to be able to get that bone in motion, at which point your body can put the bones back where they belong? And so we do use a drop table in our office. And you can see this kind of fancy looking table here in the picture. This is called a Thompson table. It's got air drops for four parts of the spine: the cervical, the neck, the upper back, the thoracics, the lower back, the lumbar, and then the pelvic area. And the cool thing about this table is that it was invented by my grandpa, Clay Thompson. He developed the very first drop headpiece to make the adjustment more gentle for both the chiropractor and the patient. So the idea with a drop piece, a drop table, is that the chiropractor just puts enough force into the patient's body to get that pad in motion. And so then the patient's body and pad are dropping through space. When the pad hits bottom, there's a concussion of forces, at which point then your body, the innate inborn intelligence of your body, will take that force and it will put the bones back in the right position. And so a drop table adjustment should be very, very gentle. And when we adjust the neck, we only do one thrust, and it's not a twisty move. So you can see here the patient's head is turned to the right side. We're not twisting. We don't have to like crank the neck to get it to like what we call tension or the end of motion. We just simply have the patient relaxing very comfortably with their head turned, and then we give a quick little thrust to get that drop pad in motion. And when the pad hits bottom, that's the adjustment. So it's quite comfortable. For people that can't rotate their head very far, sometimes, especially elderly people don't have good enough range of motion to even turn their head all the way. We can adjust with the patients with your face straight down even, where you don't even have to turn your head. You're just in a completely neutral position. So let's talk a little bit more about the technique that we use in our office. So when my grandpa developed the very first drop headpiece, at that time in history of chiropractic, the profession was focused on the top two bones of the neck, the C1 and C2. And so when he came up with this full spine drop table, then he had to come up with a whole different analysis on how to find the subluxation and then also a way to give adjustments to the whole spine. So he went out to Detroit and spent some time with Dr. Romer Deerfield, who was developing a leg check analysis to help locate the subluxation. And from there, my grandpa developed the Thompson technique, which is based off of the Deerfield leg checks. So the leg checks will show the chiropractor if the subluxation is in the neck, in the low back, in the pelvis. And so we follow the leg check, what the leg check shows us, to know when and where to adjust, which is pretty awesome. So when you come to the office, you'll lay down on the table, and I'll be looking for one leg that looks a little contracted or pulled shorter due to the subluxation. And we'll have you turn your head to the right and to the left, and we're looking for a change in those legs. We're looking for them to balance out when you turn your head to one side, and if that happens, then we know that we need to adjust your neck. So we'll go up and we'll feel along your neck for what we call a tender or painful, nodule. And wherever that little tenderness is, that is where we give you the adjustment. Now, if there's no tenderness, then we adjust the top bone in the neck, the C1 vertebra. So this headpiece that we're adjusting on doesn't just drop straight down, it drops down and it goes forward. It's called a forward motion headpiece. And the nice thing about that is that when, let's say this is the chest is here and this is the head, when we give the adjustment, the headpiece is dropping down and forward. So it opens up the vertebral facets, allowing for a very gentle and easy adjustment of the subluxation. And again, we just do one drop. There's not a twisty type of motion. It's just a quick light little thrust into that tender nodule. Then we go back and we recheck the legs to make sure that the subluxation was corrected. I wanted to put a picture in here of my grandpa. He's so cute. So here you see him adjusting someone's neck. Now, the arm that is by his knee, that's the arm that's actually making the adjustment. And then the other hand that's kind of over the patient's cheek, that is kind of giving a little counter thrust, very gentle, and also just helping to drop the headpiece. So this is what the cervical syndrome adjustment looks like on the Thompson table. And this is the only way really that we adjust in our office, except if we're adjusting the very top bones of the neck. And I'm going to show you that next. Our favorite way to adjust the upper bone of the neck, the C1 vertebra, is the toggle recoil, which has been around for a long, long time, and it's a beautiful adjustment. Sometimes, though, we might just keep you in a face-down position and adjust your atlas, your C1, with you in that prone position. Or if, we are concerned about putting too much force into your body, we might even just use a little gentle, little clicky instrument and just tap on that atlas vertebra. It really does not take a lot of force to get that in motion and allow your body to correct the subluxation. We want you to feel comfortable when you get adjusted in our office. We use a very safe and effective technique, the Thompson technique, on the drop table. So if you don't have a chiropractor and you live in the Coralville, Iowa area, I would love to be your chiropractor. And remember, Dr. Thompson said that the greatest enemy of mankind is the subluxation. So let's get you checked right away. See you soon.